Joining me right now is Democratic Senator Maggie Hassan of New Hampshire. Senator, thank you for coming in. This
Thanks
is
for having me, Kate.
Personal for everyone. This is especially personal for you, Senator. Your son, Ben, has complex medical needs.
Yep.
And he is a young person. He is at risk if he contracts. He's at high risk if he contracts this virus. And that's why your staff was telling me that's why you're staying in Washington.
That's right. So thanks for having me on, Kate. Look, to me, this whole issue of social distancing is about much more than just making sure each of us doesn't get the virus. It's about unknowingly transmitting the virus to somebody who's at really high risk, like my son, Ben. He's a great young man, but he has cerebral palsy and a compromised respiratory system. And so I think a lot about a time 2 years ago when he got a pneumonia that wouldn't quit and ended up with fluid in his lungs. He needed really intense intervention, surgery, minimal surgery, and really intensive care to pull out of that. So what I want people to think about when we're thinking about social distancing is not putting other people at risk who will be much more challenged to fight this virus off, but also we don't want to overwhelm our healthcare system because each of these high-risk cases could in fact require multiple healthcare providers at the bedside, expensive, specialized, rare equipment. That's the kind of thing we all have to be thinking about, and it's why I'm so glad you're focusing on the need for everybody to just act as if we have the virus.
And then, Senator, what do you say? I know you've seen the video. What do you say to the folks who were seen packing beaches in Florida?
First of all, to your earlier guest, the doctor, young people are getting this virus too, and it is impacting them in significant ways too. Many of them are ending up in the hospital, so for their own safety, they really should be keeping their distance and canceling their plans to be in large groups. But they also, again, run this risk of giving the virus to somebody who is at higher risk. And so we need to focus on social distancing. It's also, because of the concern about overwhelming the healthcare system, why it's so important for the president to do more than just invoke the Defense Production Act, but actually implement it so we can get more protective gear and equipment to our healthcare providers.
Look, Senator, I want to ask you about that for sure in 1 second. I mean, you've got the message from most in leadership positions has been across the board, this is serious and you need to heed the warnings. But then there are comments from senators like Republican Senator Ron Johnson. He told the Milwaukee Journal Sentinel, well, let me read it because it doesn't make sense in the light of what we're discussing right here. He said this: "I'm not denying what a nasty disease COVID-19 can be and how it obviously is devastating to somewhere between 1 and 3.4% of the population. But we don't shut down our economy because tens of thousands of people die on the highways. It's a risk we accept so we can move about. We don't shut down our economies because tens of thousands of people die from the common flu." Is that the message that you want coming from the U.S. Senate right now?
No, it's not. And I would look forward to talking with Senator Johnson. Look, there is bipartisan concern about this virus, bipartisan action. You've seen it on the Hill over the last 2 weeks, where we have come together to put together packages to really address the seriousness that this virus presents to our health and to our economy. And, you know, the two are related. You can't separate one from the other. We need a healthy workforce, healthy population to have a healthy economy. And that's why it's so important that we focus on the danger this virus presents.
And also then, as you mentioned, protective equipment. There is a horrible situation that is already playing out where doctors and nurses are running out and can't get the gear that they need to protect themselves, to protect their patients. My father is a 70-year-old doctor in Indiana, and he is already facing these choices. He is running out of protective gear, still needing to see his patients, obviously, and he's 70 years old. And he's wondering and he can't get any more. He's having trouble finding it. What are doctors like my father supposed to be doing?
Well, and that's the point, right? And we are seeing in New Hampshire, our healthcare professionals are asking for contributions, donations of personal protective gear. That's unacceptable. It's especially unacceptable in our country. That's why the Defense Production Act is so important, and that's why the president has to do more than talk about it. We have manufacturers who are slowing production. We have workers who want to be on the front lines and help, there is a safe way of ramping up production so we get the personal protective gear out, we get the nasal swabs for testing out, there's a big shortage of those right now, and we get respirators built so that we can have more available as this pandemic peaks in the United States.
And Senator, who's also in charge of that effort, I think is a real question right now. Normally, do you think there should be a singular point person on ramping up to get the PPEs, that protective gear out?
Right.
And who is that person? Because just saying we've got stockpiles isn't getting it to the hands of a doctor in New Hampshire, a doctor in North Carolina, or a doctor in Indiana.
Well, this is what's critical here. Making big pronouncements is one thing. Operationalizing the system and getting materials and equipment to the front lines is another. So there should be
you're
a
a former
public
governor,
health.
so you actually have really important perspective on that, because this lands a lot on the governor's shoulders.
Right. This is about being in constant contact with your frontline people and then bringing that news back up and finding out what isn't working. But there should be a manufacturing expert, a public health expert in a room. Every state has something called a manufacturing extension partnership. They know what their manufacturing capacity is in every state. We should be reaching out to those folks, getting them to the table. We should be in constant contact with every single manufacturer. A list of what we need to produce to build a ventilator, and then we should get to it. Same with nasal swabs. We mobilized during World War II, and we can do that here, but we need the president to take the lead, and then we need experts from manufacturing and public health to come together along with our labor organizations so that when workers come to work to surge production, they are safe as well. That's what we can do and we should be doing, and it's very concerning to me that there's been this kind of lag, a pronouncement that the act has been invoked, but then no follow-up action.
Senator, I'm going to jump in right here. President Trump heading into the briefing room right now. Let's